And also we'll be having a panel discussion in which it will be a flow of engagement. And then all members will be allowed to participate and contribute in the panel discussion. So we'll use this session to collect inputs from you, which we believe to be major stakeholders in this ecosystem of MUHAS students in terms of innovation. As we are starting our journey to establish MUHAS Innovation Hub for students, we will appreciate receiving every comment that we could get from you. Ladies and gentlemen, again, we are honored and humbled to have you all, and we expect you all have a very wonderful session. You're warmly welcome. So the first, we're going to start with the documentary.
During the course of their study, MUHAS students have developed different ideas and projects that tend to solve different health challenges. Some of the ideas have been developed to working projects, while others were left failing due to lack of the necessary financial support and mentorship.
Hello, good afternoon. My name is Dr. Frankie Dodarabi. I'm an intern doctor at Mobile National Hospital in Brazil, and I'm the Chief Operations Officer of Families. Families is a unified pharmaceutical supply chain platform which links suppliers and retailers with medicines in the private sector, so that these retailers can be able to access the suppliers using their smartphone and get the products in due time. So Powerhouse started way back in 2017, where we just test an idea and we get a chance to go to the MUHAS charity program, which was a UK funded program, and we presented by partners including TAMSA. And so from there, we were able to make sure our idea came to life and being a product which we have right now. And at that time, we were students here, and we got a huge opportunity of mentorship from the staff here at MUHAS, where they mentored us and gave us support that we needed at that time. So I would really encourage the students who have innovative ideas to improve health in Tanzania. They can employ this opportunity which are available here to make sure that their ideas will go into product which help our community to have a better healthcare and well-being. Thank you so much.
Lakini ni website au platform ambayo inatoa elimu ya afya kwa lugha ya Kiswahili. Mpaka sasa kuna makala zaidi ya 500. Kuanzishwa kwa daktari mkononi kumetokana na kuona watu wengi wanapata magonjwa ambayo yanaweza kuzuilika kwa kupata maybe maelezo mbalimbali kutoka kwa madaktari au kwa wataalamu wa afya. Hivyo tumeanzisha daktari mkononi ili watu hawa waweze kujikinga na kuepuka magonjwa ambayo mara nyingi ukipata maelezo unaweza kuepuka.
Creator and developer of digitalized animated health content aimed at delivering health information in a simple, intuitive, and mind-capturing manner. Also, I've done physical school activities such as outreaches and communal health days, such as World Sickle Cell Day and World Kidney Days. MUHAS Innovative Ecosystem have given us chance to establish and grow. We start as Samba Kijana Project and MUHAS Challenge, and giving us chance to exhibit and showcase our work in different scientific conference and academic events that are organized by our university. These have given us more opportunity and more chance to grow.
Sasa kwa vijana ambao wanaingia kwenye lengo la kuhakikisha upatikanaji wa pesa wa huduma za afya kwa makundi makubwa matatu: ambao ni wazee, watu wanaoishi na ulemavu, pamoja na wazee. Tukifikia hapa tuone ile tunapopata sababu kutoka uongozi wa chuo pamoja na uongozi wa serikali ya wanafunzi, tukitoa platform za kupresent idea zetu pamoja na kuunganishwa na washikadau kutoka nje ya chuo. Tunaomba tunaomba wanafunzi wengine ambao wanaingia kama hii za kuhakikisha kuimprove afya ya jamii yetu waweze kushirikiana na chuo pamoja na serikali ya kufunzi ili waweze kuwa na manufaa kwa jamii zao.
White transfer, some of my students one of the biggest challenges of MUHAS Innovation Ecosystem is the fact that the ecosystem is fragmented and exclusive in terms of gender and the number of students who participate in our activities and innovation activities. And we need a solution to organize all student activities into a single meeting. And here is where MUHAS Innovation Hub comes in. We need a hub because it will create a pipeline of values which will connect all external and internal stakeholders from wishes that everyone wants to invest in, at least to create the flow of values towards the students towards the channel. This hub will take the ideas from students, the prototypes and everything that students do that system in Tanzania, and to have them make them reality. And innovation hub will take ideas from students and assess them and make them reality. I want to make the second generation of successful projects like the time from the Saskatoon and others. Want to create the second and innovators who will impact the healthcare system in Tanzania and solve the challenges that the created by the government and the society at large.
Yeah, so hi everyone, my name is Mashaka. I'm the co-founder and the chief operations of Ventures, a company that's trying to build a stable operation ecosystem in Africa. The company is based in Tanzania, but we're able to do a number of activities in different countries in Africa, in Kenya, Uganda, Nigeria, as well as in South Africa. As our ventures, we use MUHAS students. This was back in 2018. So we were implementing the MUHAS challenge. So Sahara Ventures had a consortium with Sahara Ventures and Tanzania World Initiative. So the project was funded out UNDP. So the project was aimed at looking on how to come up with solutions around health sector. So we took a very innovative approach on trying to bring the students who starts mostly in the universities related to allied science and health. So we used to work with MUHAS, we've done a number of hackathons. So at the end, they come up with a solution and we believe they were very relevant. So some of the students who appeared or is the very best innovations where that's an economic tool, and there was families and the main media. So those were some of the students who came up with solutions that were going to address some of the challenges of higher internet sector. So the point was to try to look on how ways and the students or the students who are studying science and if they can come up with a solution. So I think they were able to come up with this. So some of the solutions are still existing. Of course, and the funding, which was really, going to support the business. My experience really to engage or to work with students at the University of Mumbai, impressive, and they were, they took charge, they're very understanding. So I think one of the challenges that I have seen, at the university, they have a very tight schedule. They start to attend the mentorship sessions. So that was the critical part. So I think if they would have like come that would have been very easy for them at least to attain for some of the mentorship.
Thank you very much. I hope we all enjoyed the video, right? So up next is our presenter. I would like to invite Mr. David Joseph, who is a medical student, third year, taking a bachelor degree on Doctor of Medicine. Please, Mr. David, you're warmly welcome. Hands of applause.
Ladies and gentlemen, the protocol has been observed. Good afternoon. I'll simply be talking about the MUHAS Students Innovation Ecosystem. But it is also better to some of the global challenges that are facing the world. And most of these challenges requires innovative solutions to address them. But again, these innovative solutions also requires an active and unique approach to develop. And as a matter of fact, with the development of science and technology, we have also witnessed a huge exponential growth in the field of innovation. And currently, a lot of innovative solutions are being used to address different problems pertaining different sectors as far as human civilization is concerned. And Tanzania as a country are not far behind from the reality, because we are ranked the first among the 16 low-income economy groups by the Global Innovation Index in the year 2020. But again, we ranked the 4th among the 26 economies in sub-Saharan Africa. But the most interesting finding was that as a country, we had more innovative outputs than what we actually invested. So we invested less in innovation, but again, we had more outputs. So we may ask ourselves a question: what will happen if we increase the level of investment, especially in the young generation who are taking part in the field of innovation? But it is very unfortunate that the distribution of innovation in terms of sectors is not evenly distributed, because some of the sectors are found to be lagging behind. And one among those sectors is health, because it has been lagging behind to adapt different technologies and to adapt new digital ways of addressing issues. But again, we cannot deny the potential implication of these technologies that have to the improvement of health outcomes. So there is a need as a country and as a university to invest in digital health, and this can only be achieved if we have a stable, sustainable, and convenient innovation ecosystem for students to innovate and come up with new ideas of addressing different health challenges. And even the WHO advocates for the use of digital revolution and to scale up health interventions to engage civil societies. Now, as it has been said, the MUHAS students are not far from the innovation ideas that are going in the country. And the focus should also be in investing in young health professionals who are expecting to be the future for healthcare by creating a suitable and sustainable environment for them to innovate and come up with new ideas. Now, the ecosystem at MUHAS has witnessed a surge and exponential growth in the past 5 years with the development of different platforms for student-based initiatives. And therefore, an investment has to be done so as to foster students-based creativity with the potential to improve healthcare through utilization of digital technologies such as artificial intelligence, machine and deep learning, data analytics, just to mention a few. And we should also appreciate the support and mentorship as well as guidance from the Directorate of Research and Publication by overseeing these students-based initiatives at MUHAS. So we have two main students leading events at MUHAS, which act as platforms for students in innovations. One of them is the University Win and Learn academic event, which is student-based, student-initiated. It was established in 2006 with the aim of recognizing, promoting, and valuing the students-based creativity. But again, the event has conducted a medical hackathon back in 2020 on non-communicable diseases. And it was very fortunate to have some of the winning teams presenting in the second non-communicable disease conference at Julius Nyerere International Convention Center. The latest event organized by Win and Learn was on the 3rd July this year. It was about health promotion in Tanzania, and some of the winning teams in the category of health innovation will have their prototypes presented today. Now, the event is envisioning it to become the largest research and innovation students conference in the country. Another platform is Muhimbili University Students Symposium for Debate, which aims at creating awareness among students and healthcare practitioners on deployment of technologies in health sector. And it conducted the first ever symposium on artificial intelligence at MUHAS in 2019, but again conducted a medical hackathon on deployment of AI in addressing health challenges. And the winning teams had also a chance to present in the MUHAS Scientific Conference, and one of the teams will present their prototypes today. The latest event of MUST was on 10th July this year. It was on the application of genomics and related technologies in healthcare. But again, more important, there is an ongoing proposal for conducting a bootcamp on deploying digital technologies in addressing non-communicable diseases burden. And this is projected to be conducted in September and October, and the obtained projects will be presented during the 3rd National Non-Communicable Disease Conference. So we are calling upon sponsors, supporters, and other institutions to give a hand on preparing the bootcamp so that we can have a lot of projects that have the potential to solve the country. Now, despite those milestones in the case of innovation ecosystem, the challenge has always been scaling up these ideas into reality. Only 10% of all students-based innovations have been of family, afya tu jamii, medical awareness, and pharmacy jamii. So we have 90% of these projects are yet to be scaled. And most of them either end up in ideation stage or prototype stage. Very few succeed to reach the MVPs. And this is partly contributed due to lack of convenient, sustainable, and stable accelerator program at MUHAS that could otherwise nurture and develop these students-based ideas. But again, as it has been said, the inadequacy in financial competence is another challenge faced by these young health innovators. So the possible way forward, these students need workspace for them to innovate and be creative. The ecosystem requires facilities for students' projects development. They need mentorship for teams during the process of project execution. But again, they need a place for acquiring the necessary digital skills for health innovation, a platform where all seed funds from external stakeholders can be directed for easy allocation, we require an incubation center for health-based students projects in Tanzania. And by all of these strategies, we can join the efforts of these students to develop innovative solutions for existing health problems and improve health outcomes. And that is the main reason why we are advocating for MUHAS Innovation Hub, so as to nurture these students-based creativities. Okay, this is one of my favorite quotes. And those who are seen dancing were thought to be insane by those who could not hear the music. Technology is the music of the world. Digital technology is the music of the world. Innovation is the music of the world. So we are calling upon our mentors, supporters, and seniors to dance with us as we are trying to dance to the tune of the world in an effort to solve different health challenges in our country. Thank you.
Thank you, Mr. David, for a very nice presentation. I hope after this session, all of us will be thinking of dancing with it. I hope so. So up next, we're going to a second session, which will be dealing with the in-house students develop the health-based tech projects. So in here, we'll be showcasing some of the projects which are currently ongoing. So to start with, we're going to have the first project, which is called Elixir, which is a digital early cancer diagnosis tool in Tanzania. And the presenter will be Mr. Samudi, an ND3 student from MUHAS. You're warmly welcome. And for this session, each presenter will be having maximum of 7 minutes, so please maintain time. Hands of applause to Mr. Samudi.
Yeah, good afternoon, everyone.
Yeah, my name is Samuel Samod, a medical student. Yeah, I'm so delighted to be here. And today I'm going to talk about cancer. As we know, it's among of the diseases which are the leading cause of deaths globally. And this is according to World Health Organization statistics of the year 2018. But cancer in reality, it takes the lives of many people, including our loved ones. Yeah, in the year 2014, my aunt was diagnosed with cancer. It started as swelling on her left knee and spread to lungs. It took 3 full months to diagnose it, and by that time, it was too advanced to be managed medically. So she ended up having her leg amputated. She died 1 month later, battling cancer and leaving behind 2 little kids to cause that mother love and tenderness. As we come to statistics, there are over 42,000 new cases of cancer diagnosed each year in Tanzania, with over 28,000 deaths occurring each year in Tanzania due to cancer. When you trace the reality why my aunt died on the first place, you'll meet this alarming, daunting, and horrific experience. We have insufficient number of doctors. There is a sufficient number of specialists. The ratio of one pathologist is 1.7 million in Tanzania, with approximately 20 practicing oncologists in our country. But the standard method for cancer diagnosis in Tanzania is through histopathology. First of all, a sample is taken, then it is processed to get a slide. Then it is mounted on microscope for analysis. All these areas, they have challenges, but our analysis, our focus is on the analysis part. So we came up with the Alexa web application. This is an artificial intelligence cancer-based tool, which is simple, accurate, and fast to use. It has the capability to detect all types of cancer, and it can be accessed through web app. So this is how it works. First of all, you log in the system. After logging, you enter the patient detail. After patient detail, you upload the image that has been captured by the digital scanner. It shows your image of your patient. And you quick to get the results. It gives the result within less than 2 minutes with accuracy of 87%. And this was internationally validated by Idea Lab in 2020. And mind you, we are the first winner in the Powerhouse in 2020 by Idea Lab. So after that, you have the result for your patient. It has a specific feature showing of what is going on to your patient. Then it gives you the recommendation on what you should do about the management of your patient. Then you'll be asking yourself, how does it work? First, it uses artificial neural networks for, as we know, this deep convolutional neural networks, they actually learn and make prediction through examples. And so how to do it, we provide a set of data, and for our case, it's a set of images of different pathologies and the correct type of cancer in advance. And the more you make this system continuous, the more it becomes accurate and fast. Like, for example, a student, the way how you learn, the more you solve a lot of questions, the more you become accurate with the exam. The same applies to our system. And actually, we're working also on journalism, especially in this time of COVID-19, of which social distancing is of paramount importance. So, for instance, somebody is a doctor and he has result with patient, you can share with Josh, who with the radiologists from different departments, to improve the patient's outcome. Then, but also imagine how many samples do we receive in hospitals and how many specialists we have. So by using Alexa, it means we're reducing that workload. But also it's a real-time service, which means it uses less than 2 minutes to get the results. All these problems are not just in Tanzania, it's all over Africa. So we have the market potential of over 6 million per year. And our revenue model depends on market subscription from private and public hospitals. The Alexa started on October 2020, and we are now on validation with our main focus on cervical cancer. We are looking for 100 million to go fast. We need to scale our team. We need to find the first year to cover all major cancer centers in Tanzania, but also within the next 5 years, cover the whole African continent. Our competitors, we have Visual Farm, Ultrascan, Leica, and our main competitor Field. But when you look all of these, they're also effective and efficient, especially in the external environment. But when you look at the pathologies, how are we sure like the slides for US will be the same price? So they are possible, but also I've talked about the external validity. It means their pathology in hours would be not that much accurate. But also the processing time for them is high and the flexibility. Yeah, we have the team with the diverse skills. We have experienced programmers, we have best professionals and good marketing skills. So we have the team, we have the solution, we have the traction. So if you want to take part in this great opportunity, please come and invest with us. Thank you.
Thank you very much, Mr. Samudi, for a very nice presentation. I hope after this presentation, someone is very interested to invest their 100 million so that we reduce the loss of our beloved ones. So sorry for your loss, Samudi. So up next is another presentation. It's an app called HIDIT, HIDIT, which is a health information digitalization and integration tool. And the presenter is Mr. Johanna Laser, and the 5 students at MUHAS. Mr. Johanna, you are warmly welcome.
Good afternoon, ladies and gentlemen. As introduced, my name is Johanna Liza, and the 5 students at MUHAS. I'm here to introduce to you Health Information Digitization and Integration Tool, abbreviated as HIDIT. So I would like to start by citing a very famous saying in the 21st century that data is the new oil. So I want to take you through how we handle this precious resource that we have abundantly in our country. And this is the situation. So our information, our data is mostly stored in hard copy format, which is not easily used. It cannot be used in the digital world. And this is how it should be, right? So you remember that big spacious room we saw in the previous picture? It could be more efficiently used like this, don't you think? Or even could be used like a pharmacy store. So that is why we are in a mission to change all hard copy information in Tanzania pertaining to health into soft copy format in a fast and more efficient way. And so what really is the problem? Data is collected daily in hospitals or healthcare facilities. They are confined in hard copy, in papers, and later they have to be processed at the collection level. They have to be processed, tallied, and then manually entered into electronic platforms. So the whole process is cumbersome, time-consuming, and it actually reduces the quality of data. So that's why we came with a solution of changing this hard copy data or the paper document into digital file that can just be taken by your smartphone or by a scanner. So you just have to take a picture of the document or scan, and then our system will convert it into a digital format. And the technology behind our solution is the use of artificial intelligence in terms of computer vision, which is used to extract the text from documents, and supplemented by language processing in case of difficulty in writing. And we've incorporated top security features like secure hash algorithm to make sure that this information remains confidential. So how it works, it's a mobile application. So you just open it, and then you can insert the photo that you've just taken, and then you start processing. So this picture will be processed, and you can see the output here. These are the words extracted from this picture here. So this is the prototype we're now developing, and it has reached the accuracy of about 40% for human handwriting and up to 80% for printed documents. So the output that we can get from the software can be used in report writing, which is how it is mostly used right now. And it can also be integrated into the existing electronic platforms like Jiva, Care2X, .com that is being developed right now. And it can also be stored electronically and can be shared, most importantly, can be shared in the data ecosystem. And according to the internal auditor general, the quality of data was 45% by 2016 and rose up to 84% by 2019. But mind you, this data was processed at the collection site. So it cannot be very useful for other people unless they go back and collect that data. So with our solution, we can improve the numbers, and also we can help to make this data that we're collecting useful in the continuity of care of patients. And so it is estimated that up to 2033, about 79 billion transactions have to be used to computerize primary healthcare data. And this makes our total available market. And with the facilities that will be ready to take this solution, makes about 33% of all the facilities, which can be our service available market of about 26 billion transactions. And we have estimated that the production cost would take 7 to 10 million Tanzanian shillings for the application to be deployable, and it can be charged 200,000 Tanzanian shillings up to 1 million, depending on how big the facility is. So we started designing this product February this year, and by April we started prototyping. We are now in the phase of prototyping. We're training our model to be able to read more handwritings. And by January next year, we want to start testing the software and launch by June next year. So this is the team behind the software. It is made of students from all backgrounds, all universities, sharing our skills to make sure that we make the most efficient possible. And we would like to get in touch with you through our contacts, and together we can make this vision a reality. Thank
you. Thank you. Thank you a lot, Mr. Johanna Leiva, for such a nice presentation. I hope if this model succeeds, as a country, we're going to save the 79 million that you mentioned. And I think people will be more interested in investing on this. So if you have any questions for the previous presenters, they'll be available after the session. You can have time to ask them. So moving up to the next presenter, Ms. Ida Mwesiga, who is a medical student, BMLS year 3. And she'll be taking us through a quick app. I think she'll mention more about it. Thanks of applause as she's coming.
Good afternoon. So, as I already
Where is your presentation?
So as you're waiting for the presentation, I'll just a simple question for everybody in here. How many of us do smoke? Honestly. Okay, smoke cigarettes. Okay. Yeah. Okay, how many of us can tell that somebody somewhere is smoking? I don't know. can sense the smell of smoke, the smell of cigarette smoke. So from the real-time perception, research shows that every one of us is a second-hand smoker, right? That's what I'm here for now. So, I mean, I was speaking of smoking, right? So there is a big problem pertaining smoking, like in the last current research pertaining having the burden of non-communicable diseases. We chose cigarette smokers as the point of focus because a lot of researchers show correlate cigarette smoking only pertaining respiratory diseases, but the effect of cigarette smoking are far beyond respiratory system. Cigarette smoking is a risk factor for a diversity of health threats, as you can see. Mental illness, cardiovascular diseases, gastrointestinal diseases, pregnancy complications, and all that. But the available literature is chiefly correlated with respiratory diseases, maybe. Just be, this would be a point of research. Research are very clear on the respiratory part, but the effects of cigarette smoking are just silent on the other body systems, which shows us. This is just snapshot of just the problems of cigarette smoke. But then we come back to the secondhand smoking. Globally, 41, according to the WHO data, 41,000 deaths among non-smoking adults are attributed to secondhand smoking, and 400 deaths yearly among infants are attributed to second-hand smoking. In streets, maybe last night, I was just asking myself if a second-hand smoker can be addicted, and I was with a friend. Somebody somewhere passed by smoking, and my friend told me that he loved this the smoke of cigarettes. So what came to mind is like even the second-hand smoker can be addicted at some point. So we either choose to cut the burden of smokers or decide to join the group of smokers and become smokers. And as we are all candidates of the effects of smoking. So we have a solution. This is our concern. It's a technological based approach, which is going to help the smokers quit smoking. So as an intervention of a number of health threats, as we have seen, how it's going to work, it's by AI analysis of the client's fed information. Then the client's fed information the report is going to be given on addiction levels of this client, and it's going to be managed accordingly. Primarily, this app is going to be integrated in the management of all in hospitals to all patients the history of smoking. This will be integrated in their medication. So this is it. This is going to help to individualize the treatment of this person, whether addiction is obvious because, okay, I'm not going to display the prototype, is going to be displayed outside, but it's going to actually show, individualize the treatment of this person. One of the questions which is going to be asked, it could be an account. This person is going to open an account on this app. And one of the questions is that, have you ever tried stop smoking and you failed? This will give a heads up that this person is addicted. Because if you fail, if you can't stop doing something, it means you're addicted to it. So our market size,
Okay, primarily the internet is available in all target healthcare facilities, that's no doubt. But Tanzania mobile phone subscribers, 47.8 million. Tanzania internet users, 49% of all Tanzanians have access to internet. But something I did not speak about is that 26.7% of all Tanzanians are smokers. This data does not include secondhand smokers and raw tobacco smokers. But also, our product is user-friendly. Daily motivations will be given to the users. Gradual progress will be shown in a form of graphical plots, and visual words will be given to the good progress of our clients. So this is our milestone. The idea was in 2020, prototyping and content development in 2021. We do the market validation in 2022, software development in the same year, and launch our app in 2023. Our needs, we only need 6 million, which is going to cover the software development, programming, and the market validation. So this is the team, well equipped. Thank you.
Thank you very much, Ms. Ida, for such a nice presentation. We're very sad that at least one of us here is a smoker, like 26% is approximately 1 out of 4 people. So 1 out of 4 of us is a smoker, and suddenly maybe all of us are second-hand smokers. So if we help others quit smoking, probably we'll also not suffer the effects. Up next is another presenter who will be presenting about an app called MUHAS app, which is a cardiology app, and he'll tell us more about this. So hands of applause to Mr. Faustin Kersi, who is a 4th-year degree student.
Good afternoon. Well, good afternoon again. My name is Casey Austin, 4th-year DD student, and my team and I have been working on the MUHAS project for approximately over a year right now. For me to get started, for the slides to be set per second for over 6 seconds, and in those 36 seconds, there's one person who loses his life in the US due to cardiovascular disease. By the end of my presentation, if I use 10 minutes, 70 people have lost their life in the US due to cardiovascular disease. So our big idea at MUHAS is to create a mobile solution, which is a mobile app that will use artificial intelligence to nurture early detection, prevent, and improve quality of life for people living with cardiovascular disease. So the problem outlook as for data in 2010 is 17.9 million deaths occurred worldwide due to cardiovascular disease. And that was 13% in Tanzania, with an estimated of a 20% increase by 2030. Now, of the 87 facilities in Tanzania that have the ability to diagnose and monitor hypertension, only 16% of the facilities are equipped with a first-line drug for treatment of hypertension, with at least 2 first-line drugs. Now, for the people living with hypertension in Tanzania, 53% of the newly diagnosed cases have never had their blood pressure measured even once in their life. And among that, 21% of the newly diagnosed have ever had their blood pressure measured. 18%
18% of the previously diagnosed were previously diagnosed with hypertension but never got treatment. 5% were previously diagnosed on treatment but not controlled. And unluckily, only 3% were of the previously diagnosed on treatment and the blood pressure is controlled. So MUHAS aims at helping this 100% of the population by nurturing their specific needs in every category. So MUHAS will offer health education on non-communicable diseases. As we know, most non-communicable diseases are brought about by lifestyle. They're all lifestyle diseases. So by giving health advice, by giving advice on every specific sector of non-communicable diseases, MUHAS aims at raising awareness and reducing the chances of non-communicable diseases, including cardiovascular diseases. It also offers health data storage, whereby you'll be able to store your vital signs. Dr. Furia tells us every day you should know your numbers as a health practitioner. You should know your height, you should know your weight, you should know your age, which is simple. Then you should know your blood pressure and blood glucose. So MUHAS will help not store them once, but store them for a lifetime. And will, the more you feed it, which will use artificial intelligence to predict the occurrence of cardiovascular disease with the traits that you have. It will also offer diet counseling, which will be specifically tailored for you according to the data that you're affected with. If you're overweight, it will give you diet according to your weight and age status. If you're hypertensive, it will give you a diet according to your status. Then it has a system of appointments and reminders, and it also has an pharmacological treatment by hosting health events like marathons, whereby people will meet and work out together to combat non-communicable diseases. Our revenue model includes subscription. So either as an individual, as a family, partnership with organizations such as CDA and donors. Our main target, though, is to partner with all health insurance organizations because it's the country policy that everyone should have a health insurance. So if this could be a package of the health insurance, I think it would be better for everyone's health. This is the timeline of our product. We started ideation last year, 2020. By June 2020, we had a first prototype and we presented it in the NCD conference at JNICC. But then we stripped down everything after getting a lot of comments. Then we made a second prototype by June 2021. By December 2021, we're expecting to have an MVP. And after beta testing, we're hoping in the future, hoping to launch an offline app because this is an online app. Our major competitors are HealthTap and LifeSum AD, but what value do we offer? Our app is in Swahili and English. It's safe and secure. It will create a database for cardiovascular disease patients in Tanzania, which we don't have. It's a step towards the personalized healthcare. Our biggest ask is mentorship and funding. We need mentorship in marketing, app designing, and app improvement. We also need about 15 million to launch this app. Here is a video of our prototype. Oh, yeah. Explain. So this is the startup page where you'll be able to select a language, either Swahili or English. Then you fill in your login credentials. Then after logging in, this is the home page. So find a place for health education. Then you get education on your heart or oral health, or Then you get your appointments, or you can create new, check pending appointments and check your completed appointments. Then we also have, My Heart, where you fill in your medical condition, medication, allergies, blood type, weight, height, blood pressure, glucose, and such. Then events where you can buy and book tickets for health events. You also have diets and a quick test yourself on the knowledge you've obtained from the app. This is our team, and thank you. Please, you can take a photo of this slide because I think it's the most important slide for connection.
Thank you very much, Mr. Forsten, for such incredible presentation. And I gained some interesting things, like I should know my numbers. Do you know yours? I hope after today we are all going to find out what our numbers and have them recorded. So they're just asking for 15 million, from which we could gain a lot and save a lot of lives. So this marks the end of the second part, which was a representative project of MUHAS students. So there are many more projects. You could contact us and we could link you to different projects according to the interest of your company or your personal interest. So the third section, which is among the most interesting sessions, which will be involving you also as stakeholders, will be the panel discussion. So without any further ado, may I welcome the moderator for panel discussion, Ms. Annabelle Itaeli. Hands of applause as she's coming. She's a medical student, a fourth year, and she'll be moderating this panel discussion. You're all welcome.
Okay. Good afternoon. Good afternoon, ladies and gentlemen. Okay, in front of you is Annabelle Itaeli. I'm a fourth year medical student at MUHAS here. So I'll be moderating the panel discussion, and without further ado, I'd like to welcome our esteemed panelists. So we have Dr. Felix Sokons. He's a PhD holder of in medical informatics from the Heidelberg University in Germany. So he has over 16 years of experience in information and communication technology industry, and he's also a lecturer and researcher and consultant at the Directorate of ICT here at MUHAS. And he has served as the Director of ICT here between 2015 and to 2020. So please have your seat, Dr. Felix. Okay, so we also have Ms. Promise Makale, who is from COSTECH. She's a tech enthusiast and a communication specialist. She's passionate about research and management and women empowerment in technology. So she really believes that technology has a very huge transformative impact on both research and entrepreneurship. Please, a round of applause. Okay, we also have Jacqueline Eugene Goy. She's a fifth year medical student, almost a finalist. And she's very interested in literature and innovation. Jacqueline is very well known for Afetun, which Afetun makes animations that help to teach about health. Please have your seat. Okay. without taking time, I'd like to start. This time I'd like to ask my first question towards Kelly. So, one of the major problems that we have in Tanzania that sort of limits the innovation that you can use in technology and data is that there is no data or in electricity in the rural areas in Tanzania. We wouldn't like to make innovation in only works in the big cities or only in areas with tech. So, what are could you just tell us any other challenges that you see are in Tanzania that are delaying the development of technology and how Tanzania can fight or solve this problem?
Thank you, Madam Moderator. Good afternoon, everybody. First of all, I would like to appreciate the opportunity to be among the panelists, but I also want to applaud the students for the nice presentation. The presentations were very informative, and the creativity and innovation around those are very appreciable. And we wish you all the best, and we are ready to support wherever we have the possibility to support. So there are a number of challenges that have been discussed by the presenters. You see, there are areas where you think of strategies and investments. But usually with digital technologies, there are a number of frameworks that you can use to map challenges that could hinder or that are hindering. And this can be some are called PPT. You have people, process, and the technology itself. Or you can use the other models that are called performance for routine health information system. If you are trying to evaluate information system, but they can be used in other aspects. This also goes to individual players, that would be clients, health workers, health managers, and also policymakers. And then you have organizational issues and also the technology issues. So in terms of technology, you talked about electricity, which is one of the important infrastructure for supporting or enabling supporting innovation, especially in terms of adoption of the tools that you have developed that are dependent on electricity. But you also need standards and interoperability with regards to information systems. But in terms of organization, you also need legal that support some of these innovations. Issues related to data sharing, data security, personal data protections. We currently are missing some of these guidelines and approvals to support. But our processes are also kind of siloed. Those are affecting innovation because your innovation is not going to be adopted if it doesn't align to the workflow. And the health system is silos and a lot of complexities in implementing even some simple solutions like electronic record in the facilities. So you have siloed initiatives, siloed systems, because we're missing the key component in terms of organizational aspects with regards to leadership and governance in digital health and innovation. It's a lack of motivation among users, organization not providing required incentives to support innovation and to adapt to the solutions. I think those are some of the key, but the other aspect is in terms of users. If your solution is targeting clients, are they literate enough to use the solution? Would be normal literacy, the reading, writing, and the likes, but also digital literacy to use the solution. The same for health workers. They literate to use systems. And there's a lot of capacity building needs to be done to support the use of this application. The same for data. You talked about either no data, and sometimes the data is in place, but they are not shared. They are of poor quality in some areas. So the silent systems also creates silent data. So the solutions need to be data driven to support data of good quality, but they can be shared among different users or prospective users, and we need bigger development to support data management or data governance as well as sharing. I think that's it for now.
So, as Dr. Perez was answering, I saw this promise knowledge a lot. So, it is so unfair not to also let answer.
So I was nodding, agreeing with most of what you said, but I think to just emphasize on how much it is very important to hear and to have data from the user's perspective. We've had, whether it's innovation or whether it's in product or entrepreneurship, where for instance, where someone thinks of a solution in village and they say the problem is access to water. The water source is very far. We need to build, we need to build wells for the women. They are struggling to go. So we had this where an NGO, a foreign NGO, comes in, builds the well, and they go out, and then they come back a year later to look for. They come back a year later to monitor the progress of the project, and they find the women still go to the wells, and they're like, "What is the problem?" And the women are like, I go to the well, and I go to get water five minutes away from my, to get water 1 minute away from my house. When will I ever catch up with my friends? Because the time they actually went to the well was the time that they caught up, and they had this girl talk, because the rest of their days are spent either farming or child rearing or something, and the men are controlling the rest of the world. But when they're together, and there's two of them, or the three of them, or the four of them, it's 5 o'clock. We go to the well, and it takes us an hour. And in the middle, it's a social event. So building a solution based on what should be the ideal ratio, people shouldn't go far to fetch water. Clean water should be accessible. May not always be the right entrepreneurial solution, or might not be the right innovation for that setting. So, which is why I was agreeing with Dr. Sukums that it's really important to understand your target audience in your market.
Thank you very much. Thank you very much, Ms. Promise. So, I'd like to ask you again. So, as a user and as a client, what do you think in Tanzania is an urgent solution in health that technology can be incorporated?
I think the beauty of technology is it can be integrated in anything, anywhere. We had a new class of agri-tech, and that's because we pushed for agri-tech. And there was a time when Kilimo Kwanza was our slogan, and that's what we needed. In industrialization, we pushed for industrialization. I think David, when he was presenting, was talking about MUHAS Challenge, which at the time we thought, how could we incorporate ICT and health into that? So that became a push. So I feel like tech can take anything. The demand is quite out there. Who thought we needed taxis close to us until Uber told us we did, and we did. But it can be integrated in anything, and it's not a matter of what is the current solution, but I think it will be what is passionate, what is the problem you've seen, and what is the problem you're capable of solving. I think I like the cancer diagnosis. This is close to us, so this is close to my heart, and that could be a solution. But then again, I think someone can point out that when Facebook came, who needed Facebook? We had MySpace, but it's someone that did it better and something to do. So it can be integrated in so many societal problems. We still have a lot of food security innovations. We still have a lot of tech playing parts in fintech. And who knew we needed M-Pesa? We were all comfortable waiting for Visa to come whenever they will come and acknowledge us. And then someone said, actually, maybe I don't need a POS. All I need is my phone that is on there. And that was worked. So I think we need to also think out of the box and not more, maybe this would solve, world hunger. Maybe this will get us closer to food security along the way.
So speaking about the type of expense, Professor reminds me, there was a time that we had to always go to the Western Union whenever we went to withdraw money from abroad. But literally today, it's 1 second away. Sending money from abroad to directly get the money. So it's very interesting how the world changes and tech brings solutions that we never knew would be there, but right now we cannot live without them. So, for example, if this goes to anyone who wants to just start out and learn more about tech, when I go online, I see a lot of material. So, what would you recommend to be the best, like, or the most, the set of things for me to learn? I want to grow my knowledge in tech, and especially make it very.
I think if I got you right is in terms of what kind of problem are you going to address? I think our health system has a lot that we can do. Be it now that there is a solution on the ground or a new area that has not been addressed, right from digitalization of provision of health services, resource management. We are all aware that the Minister for Health is always struggling in terms of availability of health in the health commodities, right in the supply chain. So that is one area. How are we going to use these digital technologies to have an optimal utilization of the scarce resources that we have? Do we have, how do we make a decision during patient care or during allocation of resources, be it health commodities, human resource, and financial resources? So we may be thinking out of the box in terms of which area are we going to addressing. Some of the presentation are addressing solutions related to clients in terms of health promotion, health education, and the likes. And we are also, health workers are also facing a number of problems in provision of services. How do you use technologies to address? We sometimes need to have, we say user-centric design or human-centered design. Work with them. If you're working with them, look at what kind of problems they are raising up, or discuss with them how can technology address their problems. In terms of how are we going to learn, I think the answer is around this room. You see the presentations that we have done. Collaboration between tech and health and other disciplines. You see the multidisciplinary approach in terms of peer support, peer learning, and mentorship to me is key. Yes, you can go to classes, but you have to see most of the innovators are just thinkers or people who are thinking out of the box in terms of problem solving, analysts and the like. So you can learn from your peers. You go to schools, now you have online classes where you can learn a lot of ABCs with regard to digital health, innovation, any other discipline that you can learn. Of course, you need certification if you want deployment, if you want any information. I think the peer support that we are seeing, if you have MD3 students presenting a lot of AI issues, which even IT graduate cannot do, that means the space is there for everybody to learn. That's what I would say. Thank you.
I think everyone can hear. I can project, right? So I think one of the most important places, I think you're your peers, is also being involved in the, if you want to know about tech and innovation ecosystem and what's going on, there's a whole innovation ecosystem, the Tanzanian innovation ecosystem that is going on. And there's a lot of events that continue from that. But also periodically, you have the ecosystem mapping reports. This year we've had 2 ecosystem mapping reports, one from the UNITC and another one from the HDF learning scopes. So all these are things that you can keep up with what technology and what innovations are out there, but this frequently all the pitching sessions are usually open. And I think there's the Innovation Week that always, the National Innovation Week that always happen every annually. I think next year is going to be in every district. And then there is, Textile Week that is happening, Textile Week Darson that's happening next month. And there's a lot of ecosystem events, as I say, peer-to-peer and seeing what other people are doing.
So my next question goes to Jeffrey, and so as you know, we work in different activities, but one of them that is very objective is the African. So I'd like to ask if your animation idea, the original idea, or you had a different idea, then animation came over, because when you have a startup, you might have an ideal idea, but along the course, you change your thoughts and think maybe this could be a better way to portray my idea, or this could be a better way to do this. So just tell us the journey.
Okay, thank you. Very thankful to be here and representing African as well. We've been in this conference over the years, and I think today we will share a bit about us. From COSTECH, you've seen that it was initially among the most innovative ideas, and that's where the Hackathon Challenge, Hackathon as a company started. But initially, we did not think of animation. Our very first idea was biometric registration, which enabled young girls and adolescent women to stay in school. So it was for monitoring attendance. Animation was just the soup, but the whole bread was the system which monitored attendance. But then as time went on, we took on animation as the main goal, and initially our ideas were also not about the current projects we're doing. We started with the project which is Kijana, which COSTECH and Sahara Sparks will identify as the initial idea, which was, so Kijana was based on sexual and reproductive health. But then as we kept on learning, kept on exploring the education we get in class, we found that we had a passion to the idea into something which grows. We grew with the tech, we grew with the way we made our animations, but also we grew in knowledge, skills, and marketing and everything. So we are currently doing animations, but we're also doing comics for those who have seen. We're also doing talk shows, which will be coming soon. We'll be doing podcasts. We'll be doing a lot of changes and improvement, because the idea, as maybe for people who are founding ideas, they'll tell you that you initially have one idea and you will have multiple ways. It looks like a drawing, but with no meaning. Then you pick one of the things that you're doing and you embrace that. So for us, we call ourselves a youth-based company which deals with animations. We use this format. Right now, we deal with health and education in various ways. In every graphical way you can protect changes. So for the apps which are actually developing, I think that is among the first things you should also think of as in part of mentorship. For us, it was the same. The more you meet new people, the more you engage in innovations, the more you realize there's a lot you could do, add up, top up, change your prototype, and build the product. Thank you.
Okay, so previous presenters, they needed finances to do this and that. So how were you able to mobilize the finances?
Okay, so we have two ways of financing, let's say. One is material, which is money, and the other which is mentorship. So for the material and financial, we had a seeding fund of 8 million from Sahara Sparks when we won the White Challenge, which we received in quarters based on how our idea was actually working, and we managed to go through all the stages and receive all the funding. But then as we kept on changing, we have been engaging with different stakeholders. Currently, we are doing a project on making the hospital waiting areas more attractive, more relieving, more educative. And we've been working with different hospitals, including at Kalo and the Moi. So the Moi Hospital. So yeah, we get funding from those ideas. We also make short animations for private companies. But in terms of the other non-material way, we have managed to be mentored by very good people, people who actually see a very bright future in youth. One of our mentors is here, and I'd like to applaud Dr. Gani for that. He's our patron. We had another doctor, his name is Dr. Mombe. And here at the university, we've also been welcomed, and we've been engaging in different activities of the university. As today, we are actually presenting at the TCU because the university gave us an opportunity. There are some of our team members there. And during the Sabasaba, we also presented for all of the 15 days. So the mentorship is among the greatest thing because the mentors will introduce the people, will give you ideas on how to bring funding. Our education as medical students is of thinkers, but we have these concepts that we have to grasp so that we can, of course, change them with time, but we do not learn marketing. We do not learn animation. This is a different course, a different stake know-how. We do not learn how to make stories, but how we make stories. But then with the mentorship, we have people who were working from universities like PhD, from most where these are software engineers. So as time goes on, we keep meeting new people, and it's more of the mentorship and the money. But greatest thing you could have is somebody to hold your back and do yourself when you make it. Thank you.
Thank you very much. So, what's the saying that you have to go further? So, my next question goes to the parents. So, why is it so difficult to have collaborations in tech? For example, currently, after Zuckerberg bought WhatsApp, that is when WhatsApp and Facebook and Instagram were collaborated. That is when you post one thing, post the rest of the social media. But of course, this was supposed to start a long time ago because generally most people are in free of social media. So why is it so hard to have collaboration with technology in anything? Even in health, it's very hard to have collaboration, even between hospitals. If somebody goes from just one department to another, they have to start over, and it gets more tedious, it's more expensive, all that. So why is it so hard to have this collaboration, which are very meaningful in bringing tech power and making it fast?
Thank you, Madam Moderator. I think that's a bit a tricky question, but I'll answer that now. Later on, ask my colleague to have to comment also on that. But I think it's the spirit of business enterprises that you maximize the profit. And one way to maximize the profit is to create a monopoly. It's like you're asking Pepsi and Coca-Cola to collaborate. We are competitors, so I'll strive to make sure my product is the best so that I gain more market value and revenues. But whenever there's a possibility to buy out a competitor, then I do, and that's what I think Facebook or so that we did. So the other aspect in terms of collaboration, they are collaboration. You have a collaboration between hardware vendors or and software service providers. So it all depends on the area that they're working on. So if you have a hardware manufacturer, they collaborate with software because they have a mutual benefit out of it. Otherwise, there will be competition. And in the US, there are areas where they have kind of legal proceedings in terms of is this buyout, is it going to create a monopoly that we are going to be affected in terms of the ownership of that you recall months ago had a lot to do with the US government in terms of how we settling our data out of the system. So it's the spirit of maximizing the profit, creating a monopoly, but there also needs to be legal regulatory frameworks to also make sure the competition is fair enough. I think that's my comment. I will ask later with your permission, Dr. Gani is an economist, he will be able to provide a quick perspective of that.
Thank you. I should say something. But I think, first of all, I should congratulate all of the presenters. It was a joy to watch this. As a university of being tasked to find a way in which MUHAS can contribute to the economic evolution of Tanzania. So I'm glad that you can see people heading there. People who are trying to do that. So I think one thing is, as put it, it's a very selfish world. We don't need to be around that. I was a little bit bored when I was seeing some of the milestones here. It's a project that is 2 years to come and it's already presented. You may be surprised that your project will start working next year. So we have a lot of good examples. Some of these we know them. Some of young people here wrote projects that are very popular in some radio here in the restaurant, but they are taken over by other colleagues from the same university. So it's a little bit of very complicated work when you start an issue about collaboration. But I've seen some of you have done that already. There are people from DIT, there are people from MUHAS, and there are people from there. I remember I was defending my PhD. Someone said, you know Africa, and use your knowledge of Africa to get access to the space of science around the world, because you are the only one who knows you are. So you guys know next, know that, okay, that should be your strength in collaboration, because the people in IT, they will know some ITs, but you will know that you can. So use that as your weapon. Secondly, the project was convincing, but the business part of it was not convincing. That you should work on. Wanted money, 100 million. What am I going to get? So I think that's an area that you need to improve on your business plan. What is your business plan? What am I going to get if I put my 100 million in your project? And if I was to put that in like the other 200, they had 8 million, but the 8 million were gradually being put in. So when is the break even? When do you expect that by putting 100 million, is it going to take another 20 years before we break even? Or is it going to be a charity so that I know that I'm going to put this as altruism? Because when you put things as altruism, then it's just like you want other people to get something out of it. So, but don't be worried, you fall down, but just stand up and walk. It's a very difficult area, but I've seen a lot of young people from the beginning. And the IT guys are very selfish. A lot of my friends work in IT because I've been helping them at the UPSM when they started HS2. They sometimes don't even say what they're doing when I'm in. I don't even know what code is, but they stop talking. I just don't know. But when they're talking, they're developing something, they'll just look at me and they stop talking. I don't know what they're doing, you know. I'm there to help. So this is how you should talk to her to at least start registering your products. Get some copyright things slowly when you're developing them. Go there. And one thing I've seen, people lose hope here at this university. They're very good in IT. When they start practicing, they become very good in physician and over. It was I was a kid, I didn't know what I was doing. Now I know what I want to do. Surgeon, drop. This story is over. You just show your kid how enthusiastic you are. So please don't drop that. For a very good example, we had our colleague who works in Google. Max was a pharmacist here. Now works in Google, Germany. And this is the guy who was disturbing Sukumus all the time. He was in the postgraduate IT. Another colleague is a director of communication in Africa for the FICO. The rooms there. He never dropped his passion. He continuously worked on. He was not pushed into the family pressure that we took you to be a surgeon. Why are you doing this? But now he's a communication officer for all of the FICO. Now, actually, I think he's an assistant for global communication with the FICO. It's a huge position. So don't give up what you're doing right now. Don't worry if you fall down a little bit. Just keep marching. I have a friend of mine who's not my friend, assistant to my friend. He did his first degree at SMC in medicine. He refused to do internship. Just want to continue with innovation and developing apps and stuff. The sister asked me, we talked with him, with Dr. Bruno, and he tried and tried. The guy said, no, okay. Now he has started his master's in innovation at Cape Town University. That is him. He just refused that. So he's my friend, he visits my office, we talk about that. And I'm not supporting him now towards what he wants to do because that's what he has chosen. So keep trying to focus on that. You can have another space and talk about this several other times because now we have limited time. But collaborations are there, but you need to have very good business plan. You have a very nice technical presentation, but next thing, try to develop a very good business plan. And on that side, maybe we can find time and talk to Dr. Bruno and try to see how we can help you to develop that side. Thank you.
One more question. So David mentioned something that some apps developed but failed to flourish in the market. What are the reasons why these apps don't go and sleep of the social network students out there?
I think I would like to add on the topic of collaborations. It's not easy. I mean, even when you organize ecosystem events, even when you have companies, they would still want to have the same platform. If you look at companies the same, but then the business models are also very important because Facebook business model versus WhatsApp. WhatsApp had always market itself as it would never sell data, it would never have an app place, it would never sell to your consumers. Your consumers, it's a safe place. Whereas Facebook has been selling our data from the get-go. So it's the merging of the two. Like if you were actually one of the founders of WhatsApp, it would have been very difficult to have that. So it goes back into business models and what it is. And you're forgetting that I think one of the speakers mentioned that right now data is oil, it's the new oil. So that and being able to mine that, the only way that Facebook would get to do that is to buy that out. But back to your question on why apps fail, I think going back to the sustainability model. The biggest problem we have is sustainability. So yes, it's your passion, it's amazing, the tech is amazing, but then how do you sustain it? Where is your revenue model from? And that can change over time, I think, as African said. When you start out, you're like, okay, I'm a biometric, I do biometric before girls do schools want this. Would they have it just for girls? And then eventually your business model should change. So the second problem comes is adaptability of that. So you innovate, you come into the market and you say, this is the problem, the market issue is this much, and this is my solution. It's amazing, it's going to be just a fraction of the price. But are the users really, is this really what they want? Are they willing, even if they do what they want? Because unfortunately, what we end up doing in the ecosystem is doing user testing. And the user testing, when you're doing in the time when you're prototyping, is I'll go to Dr. Suku's. I know you. By the way, if I were to develop an app that brings you water right here, every single time you want, would you want that? And you go, yes, because he knows me. Okay, yes, and definitely. And then would you? And they probably would have done it if it was for free. But the moment you say, by the way, so that water that cost you 500 shillings, I'm just going to sell it to you at 550 so that I can sustain my app. But then, no, I can walk. So that is eventually what ends up. So while you're innovating, you're having a solution when you have a sustainability plan, the failure to adapt to the new markets or the new once you have to get into the market, the new conditions in the market. People fail to do that, and at the end of the day, they can't adapt long enough. And then there's also a problem of having conglomerates. You might do something, and then at the end of the day, you realize that there are other monopolies into this market. But being able to adapt to that, to having the human-centered design into that, like you always adapt. Because we've had even programs that I established, even the health interventions. That's the market. This is the problem. And then when you go in, you're like, no, we didn't need, like we had a program that come in and say, we want to fund startups 100,000 USDs. And just to come into the ground and actually realize there are no startups. That is Y series accelerator startups. Our startups need 10,000 USDs, and then you're going to move forward to have an MVP or a product. That market, that large scale market isn't there. But then being able to adapt to what you find in the ground. And then at the end of the day, I think what you're listening to African say is also the lack of growth driver strategy. So you get into the market and realizing that every single product that you have, every single feature that you have could possibly have different user testing or the users for it. So I think I was listening to the Quit app. What a secondary small I can identify my problem, whereas, I'm a primary smoker, whereas it might be different from what the second-hand smoker would. So that would actually require, when you're doing a growth driver strategy, to have a different marketing strategy or have a different altogether subset for what your marketing is. So a lot of the apps would come in, they'll probably get funding, but failure to integrate all these, and you have the death valley of apps that will always happen.
And those that what do you as a student, what are the advantages that doing after what are the what are challenges?
So start with the advantage. When you're a student, every time you have to present yourself with an ID, right? So we've managed to enter so many doors with just an ID, where other stakeholders will have to pay to get access. And I think one other advantage that we've had as students is not being tied to particular institutions in terms of employment or expectations, like we're required maybe to we work in different organizations. It gives us we're more flexible to work with different and so various many opportunities and industries which are already working or are already functioning. So that's the biggest advantage. And maybe it's when you're a student, you have time to think more, you can create creatively more. On terms of challenges, the kind of innovation that we do need technical knowledge, technical know-how. So we came here to be doctors. Of course, we did have other skills. I have been training on programming since when I was young. I've been writing, but then we came here and we had to animate, to create a movie, a motion graphic video, to create a character, to draw an illustration. So we had to take time to learn those. And with the funding we've been receiving, we have been able to train 3 illustrators who are the ones making comics, but also we have been able to train 2 3D graphic animators. Of course, with the writers, we are actually learning through online. We have the University of the People. For those who do not know, it's free. It's from Google. You can learn a lot about spectrum and everything. So the time now, when do you learn? You see, animation or let's say innovation itself is a different aspect from academics. So you have to, it's a divided attention. It's a game where you have to divide your attention between your academics, your social life, your other life, your values, and the learning, the process, and actually functioning. So the timing has been difficult. So we have to work extra hours, sometimes we work at night. We actually hold our meetings from 22 hours every Thursday. So you can imagine you're on call, you're just back on call, and then 22 hours on Thursday, you have to be online, so you can participate. But again, in terms of challenges, it's been on obtaining of funding. Some people have a notion that when you're a student, you do not know enough. So we have been actually facing a few difficult people who think we may be projecting things which are not correct. And this is where our mentors actually come in the university. So we had to get people who are already in the system to help us proofread what we are producing so that it looks great or people believe that it's actually correct. But above all this, let's say there's a silver lining to all this. The more challenges we've actually encountered have actually gave us a lot more to think of, a lot more to, I think, we believe we can even mentor the ones who actually come in. So beyond all this, maybe I'll just say one thing in terms of collaborations, which we also had a bit of conflict in. So collaborations, we can collaborate with people, but you come to that legal point. Well, first, we were very scared initially that people would actually steal our idea because animation seems like a very easy thing to do, but then it is not easy. And people actually tend to take other people's ideas. We have seen somebody produce, we had some accounts in YouTube which was actually posting our videos, and we had to report it, something of the sort. But again, this innovation seems like very easy work if you're just looking at them. If you're just seated somewhere and you see somebody saying a cartoon and you see it's a comic, it's a 4 picture, and it's just a cartoon there, it may look extremely easy, but the process is extremely hard. So sometimes the value that you create to the market is actually underestimated. So that has also been a very great challenge, but for us, we have been trained by our mentor to always stand our ground, learn the market. So we are also learning a few things on economics and marketing. So yeah, but as I say, there's a silver lining and there's a lot more now. Thank you.
Thank you very much, Dr. Nami. I'd like to request that and I'd like to hand over back to our director who will lead us to the question and answer.
Thank you very much, the panelists. It was very detailed discussion, and as stakeholders, we got a chance to gain one or two experiences from the discussion. Thank you for the contribution. It was such a pleasure. I think Jackie tried to pinpoint a lot of challenges that we are facing as students, and I believe as some of you are from the administration of the university, you can try to consider this like if the part of only being students and doing this stuff as extracurricular activities, we could do this much. What if these stuff were part of our curriculum? I guess we could do even better. So such things can be included for future use in MUHAS. So thank you all, and hand of applause to the panelists, please. Okay, now this marks the end of the third session, and now coming to an end, I'll give the closing remarks, and then we'll go outside. We'll be having short exhibitions as we are waiting for the closing ceremony of the 9th MUHAS conference. So thank you all for coming, and all the presenters who presented their projects will be outside together with their courses and prototypes. So for further questions, advices, and inputs, you can always go outside and discuss with them. Asanteni sana kwa kuja. It was a pleasure having you all. Thank you.
End live stream. Sasa hivi tumebaki na moja.